Thank you, chairpersons. And at the outset, I thank Dr. G. Vijayakumar and the team of 3DCon for inviting me to this beautiful venue of Chennai. Thank you very much, Dr. Vijay. What I'll be talking in next 15-20 minutes is regarding the very hot topic of diabetes reversal versus remission. This is hot topic not only amongst us, but also amongst the patients also. Whenever the patient comes to us for the first time, they always ask, Doctor, can I stop my medicine in the future? That is always the question asked with most of the patients. So let us see some of the science behind it. What is the diabetes reversal and what is diabetes remission, or whether it is possible in the real world scenario. These are my disclosures. So we need not to emphasize this very important aspects of epidemiology or the prevalence and epidemic of diabetes in our country. Dr. Ranjit is here, and all our studies like this ICMR and diabetes study has clearly shown that this is an emergency and prevalence is increasing to more than 11 million and even more than that at the present scenario. But before that, Dr. Shanmugam has already been alluded to about this particular aspect. Before we think about any diabetes remission and reversal, we need to understand the type 2 diabetes pathophysiology, or what in progress of type 2 diabetes. And if you see here the progress of diabetes, it is when the first time the patient comes to us for the diagnosis, even 4 to 7 years, even more than that, even before that, there is an increase in the starting with the insulin resistance, hyperinsulinemia is there. And if you see here, the insulin rises here, and when the patient comes, and then there is a progressive decline in the insulin secretion. The most important aspects we need to understand is the beta cell, which has the progressive destruction or progressive apoptosis right from even before the onset of diabetes, and there is always a very gradual, and sometimes after the onset there is a very rapid apoptosis of the beta cells. And then if you see here, first the postprandial rise is there even before the onset of diabetes, and then it is the fasting glucose later on after the diagnosis. But the most important again aspect is the hepatic glucose production, which increases after the onset of diabetes. And this is again a very dreaded aspect of type 2 diabetes patients, that's around 50, not even that. Some studies says that even 60 to 70%, even more beta cells are lost even before the onset of diabetes, and this is during the pre-diabetic population. So now the question, when we understand about the progress of the diabetes, progress of type 2 diabetes, can diabetes be reversed? What exactly is the reversal, and whether it is a reversal in the real sense or it is the remission? So this is the most important thing. We need to understand very subtle difference between remission and reversal. What is the remission? Implies the normal hemoglobin A1C without the need of anti-diabetic agents. And the reversal could also mean a reduction in the number or the doses of the anti-diabetic medications. And let us see some little details about that. ADA in 2009, they actually, at that time, they decided to have a partial remission, means there is a sub-diabetic hyperglycemia for at least 1 year. That means A1C level should be at the 5.7 to 6.5%. Complete remission at that time, it was meant that it should be a normoglycemia for at least 1 year, and HbA1c level should be less than 5.7%. And of course, prolonged remission means what do you call in the question mark is the cure of diabetes. That means a complete remission of at least 5 years duration. But now the concept is little changed, And now they say that diabetic remission means, and there are different definition, different associations says that different things, but the core concept is that diabetic remission means defined as achieving an HbA1c level below 6.5% for at least 3 months. That is the important thing, without any glucose lowering medications. That is the thing. And what do you mean by the reversal? Often used colloquially to describe the process of returning to blood glucose to the non-diabetic range. That is the reversal. And the clinical distinction is really a bleak distinction. So remission is a state of health validated by specific biomarkers. That is the important things. So now, can we achieve remission in a real world sense? Yes, we can think of. With the 3 pillars. 3 pillars is, what do you mean by the 3 pillars? Non-pharmacological management, with the diet, nutrition, with the carbs restriction, the exercise, and the yoga. We have done few studies, milestone studies of the yoga in our country. And we have, I'll show you the data of this yoga and meditation exercise. And of course, pharmacological management, the people, scientists are still trying the pharmacological management. Not only management, but they have tried the remission with some of the drugs. And of course, the people who actually do the real bariatric surgery or metabolic surgery, they also claim for remission in certain number of patients. So let us start with the non-pharmacological approach. And of course, the most important aspect is the weight loss. If you attempt around 5 to 10% weight loss, that is the core aspect of doing the or thinking about the remission of diabetes. And of course, the moderate to intensive physical activity. And some people have even showed the studies with the 6 to 8 hours sleep. Just 3 days back, sir, in the Lancet they have published, if you are having less than 6 hours sleep or more than 8 hours sleep, that is again a dangerous thing. Less than 6 hours is definitely less, and more than 8 hours is also very, very hazardous to metabolic aspects of metabolic disorders. This is a Lancet publication just last week only. So that is again a very important aspect because we don't think this is an out of the box reason for not achieving the remission of diabetes. Of course, healthy lifestyle is the most important thing. Medical nutrition therapy, this has been published, and which says that it reduces the HbA1c levels of around 1% in type 1 diabetes and around 1 to 2% in type 2 diabetes, depending on the duration of diabetes. And this study done by Dr. Shashank Joshi and group in our country, and what it is suggested that all over the country, we are actually having the high carbohydrate eaters, and whether it is the north, west, central, east or south, you see we are having around 64% carbohydrate, which is much, much above the daily requirement which we are taking. And this is a recent publication with Dr. Mohan's group, and what this is, this study has suggested us, this is the dietary profile. Again, it shows that our Indian diet is characterized by high intake of even low carbohydrate. The low quality carbohydrates, which is around more than again 60 to 70% all over the country. If you see, this is the ICMR INDIAB study. I was the Rajasthan PI for that. And not only that, we are having high levels of saturated fats and low intake of protein. We are also doing one project which is a sarcopenic project, and what we found a glimpse situation is that the even youngsters, 30 to 40 years of this adolescent and the younger population are having the sarcopenia. They are developing sarcopenia because of severe deficiency of protein. They are all doing the fast foods of the high carbohydrate, high fats, and very low proteins. So we have done the pilot project, and we'll show the data later on. but we need to understand this particular aspect that carbohydrates are very, very important, which influences the glucose levels, and it is the amount of carbohydrate which is the most important, less quantity of fibers, more of sweeteners, whether it is a natural sweeteners or artificial sweeteners, and some of the important aspect of the resistant starch and high amylose foods also affect the glucose homeostasis. And this is very important. We need to understand the Roy Taylor's hypothesis, or he has done the study. I'll show the data also, that this is the hypothesis known as twin cycle hypothesis. And what is this twin cycle hypothesis? If you see here, whenever we are taking too much of high calorie food with the high carbohydrate food, it leads to accumulation of fats in the liver. So that is the very simple thing, that liver has the most accommodation of the fat in the liver, and it leads to insulin resistance. Ultimately, what is the fat is there in the liver can accommodate with a certain amount, and after that, what happens? There is a slight rise in the fasting hyperglycemia or fasting glucose, and because of this higher insulin levels, there is a conversion of carbohydrate to fat again. So first, carbohydrate, high calories, high fat, and what it does, it increases the export of fat to the whole body. So liver cannot accommodate with a certain amount, then it sends that fat to other organs, that is known as ectopic fat deposition in the pancreas, in the liver, in the muscles, and in the other organs. And because of this ectopic fat and increases, there is a decreased insulin production, eventually causes post-meal hyperglycemia, and this higher insulin levels ultimately leads to again the accommodation. So it is a vicious cycle. And just in a simple way, we need to understand that this is the high liver fat export to the other organs, increases the pancreatic fat, reduces your beta cell function. And that is in the type 2 diabetes. And what do we mean by the remission here? The remission is if we can do with the exercise or non-pharmacological approach, reducing the liver fat, which can reduce the liver fat to the other organs, reduces the pancreatic fat, and ultimately increases your beta cell function. So that is the thinking of remission. And this was the Banting lecture Dr. Roy Taylor delivered, and he clearly told that type 2 diabetes is a reversible condition of intra-organ fat excess, to which some of the people are more susceptible to others. Then there is a major research finding. I'll not go into the details, but it is the weight loss is the key factor for thinking of remission. That is the important. Around 15 kilogram weight loss in this study. And this was the another study which is very milestone study known as direct study. And this is a randomized controlled trial of diabetes of less than 6 year duration. 20 to 65 years were the enrollment. BMI was 29 to 45 and duration was 1 year. And what it does, they have given the very low caloric diet to the tune of around 800 calories, and there is an intervention group, and they followed it by up to 12 months or 1 year. There was a average weight loss of around 10 kilograms, and diabetic remission was around 47% in the direct study, as compared to control group where they achieved only in 4% patients. And that is the clear-cut first time they have shown that people in remission could return to normal insulin secretion rates if they maintain their weight after the initial weight loss. So initial weight loss still translates into the later on insulin secretion normalized sort of thing. This was the study. I'll not go into the details, but again, you see here, they stopped all anti-diabetic drugs and anti-hypertensive medication right at the beginning. Total diet replacement was there. Food was introduced. Initially, it was a liquid. And then after 3 months or so, they started the solid foods to these patients, and they wanted to maintain for 1 year initially, and they extend to 2 years later on, and that was the weight loss. If you see here, initial weight loss was 14.5 kilograms, sustained weight loss was more than 1, and then 1.9 kilograms in 24. So they achieved 46% remission in first year, and then the most same patient continued, it was a 36% later on, and that is the key aspect, is that they lost, most of the patient lost more than 10 kilograms of body. And this clearly said that there are few side effects were there, like one non-fatal myocardial infarction and one coronary artery disease. So the benefit was definitely there, and what it does, it removes need of lifelong multiple daily treatment. So we can think of achieving the remission. Another study was a look-ahead study, again a milestone study where the intensive lifestyle was tried to most of the patients, and that was the multi-centering RCT was done, and the duration again was for 1 year, and BMI was more than 25 in most of the patients. Again, what is the important thing? Weight loss of around 8.6% was achieved in the intensive lifestyle. Diabetic remission was found around in 11% of patients. That is the, again, important thing. So the second aspect is the physical activity, other than the diet restriction. So physical activity is very important. It is known as T. What is T? It is a total energy expenditure partitioned into BMR, diet, that is the diet-induced thermogenesis, and non-exercise activity thermogenesis, that is NEAT. So this is a modifiable factor. Exercise, simple walk for 30 minutes a day was considered by most of the associations. There are different types of exercises. So you have to mix aerobic, walking, brisk walk, along with the resistant exercise. And what more than Dr. Manohar is here, who is the marathoner in our, I think amongst all of us, is the only, has the, all the marathons you have run. Yes. So this is the evidence base that you have to have a weight maintenance, weight loss, and weight loss maintenance is very, very important. Exercise, I'll give you the, this is the important thing. We have done two studies rather regarding the yoga, and this is actually structural yoga we did in our patients. That was the first study was done here in the yoga intervention, and clearly showed that there is a definite role of yoga in achieving the diabetes remission. This was our study. We did it for 6 months study, and Dr. Vishwanath Katoch, he was the ICMR director. He was also one of the co-authors, sir. And we did this study, and we clearly found this study that not only we achieve the fasting glucose and postprandial glucose and HbA1c. If you see here, this is the intervention group, 9.3 to 7.2 within the 6 months we achieved just by simply introducing the structural yoga in our patients. And then this is one of the studies which is done by RSSDI. I was again an author for that. Indian Prevention of Diabetes study. We followed pre-diabetic population for 4 years. Every 3 months we followed. And what we found here, 46% reduction in the conversion of pre-diabetes to diabetes within 3 years. Just see, this is the important thing here. And the adherence was so important that it was around 82% within the pre-diabetic population, not taking any drugs, which was very, very difficult. So to conclude our study, yoga, structural yoga is the very, very significantly can reduce. Pharmacotherapy, yes, there are few pharmacotherapies which have been tried, and this is one of the important Indian diabetes study program. We know about the metformin by Dr. Ramchandran's group here in Chennai, and this is just, I have compiled for all of you. It is the direct study. Clearly, if you see total diet restriction program versus usual care, they achieved within 5 years 32% remission. Initially, it was around 74%. Surmount study, it is done by the tirzepatide. This is, and they achieved around 7.4% baseline and 11.9% in 1.5 years, tirzepatide. Then semaglutide here in the step 2 trial clearly showed that there is a reduce in the glucose lowering medications in 1.3 years, around 29% with the lifestyle support they achieved. Here in the Roux-en-Y, the bariatric surgery here, Roux-en-Y studies, and they have shown around 25%, initially 100% within 2 years, Roux-en-Y, and then within 10 years, 25%. Then the other study known as ARMS study, which is the medical bariatric, metabolic bariatric surgery, and they also achieved around 52% to 17%. And then not only so, non-pharmacological approach, pharmacological approach, or diet or yoga. These are the pillars, if you can think of remission. So dear friends, you have to lose the extra weight is the first thing you have to think about the remission. Preferably more than 10% of weight loss can achieve remission. Me 4 physically active. Around 150 minutes per week is the important thing. Eat healthy fibers, green vegetables, salad and fruits. Even BMJ says that you can reduce more than 50% conversion of pre-diabetic to diabetic population. Then the fats, again very important. It is the fat which is also one of the culprit for that. And dear friends, sooner, this is the Ann Albright, the sooner people find out they have the pre-diabetes and take action, the better their chances of preventing type 2 diabetes. Think early. Dr. Shanmugam has also told not only to reduce the complications, but also think of remission in the diabetes. Thank you very much for the patience listening.